Hello, my name is Daniel Tavickman and I am the head of integration at RehabStat, and today we are going to be learning about the 5 most common underlying needs that don't get met for those suffering from addiction. Based on the current literature and the most up-to-date psychological addiction test, the Rehabilitation Wellness Inventory, there are 5 underlying needs that are at the root of addictive behavior. Usually not all 5 are present in every case, which is why clinicians use the RWI to quickly figure out which ones are. 5 major factors when it comes to addiction are health and lifestyle, interpersonal skills, self-esteem, depressed mood, and anxiety. Each of these areas is complex and the treatment can be very specialized, which is why it's important to get an accurate diagnosis early. Health and lifestyle. Some people are living unpleasant lives or lives which are unpleasant to them. They may not know what kind of life they want to live and how to make that happen. This can lead to addictive behaviors as means of escape or coping mechanism. Interpersonal skills. There is a common saying that addiction is the opposite of connection. Some people are unable to connect with others simply because they lack the prosocial interpersonal skills that many of us take for granted. Treatment may be geared towards teaching them prosocial skills such as how to better connect with others. Self-esteem. Some people have low self-esteem that causes them suffering or it can cause them to neglect themselves. They may use addictive behaviors as a means of escape from themselves or as pain relief from the effects of not taking care of themselves. Depression. Depression often comes with hopelessness and despair, which don't feel great and can also hinder motivation. Some people will self-medicate for alleviating pain or increasing motivation. Anxiety, worry. People who are anxious may use substances to calm down the anxiety in order to get things done. Think about having a couple of drinks to calm your nerves and then become dependent on those drinks to get things done or just make it through the day. In many cases, the diagnosis of addiction may be easier to figure out than the underlying psychology that led the patient to making those decisions in the first place. Patients without specific insight tend to fall through the gaps or wind up being in treatment for a long time without making much progress. There are many cases of people who are on their recovery journey and spend years or even decades getting ineffective advice and treatment, eventually getting frustrated and giving up. They wind up spending hours taking tests, getting assessments, then become disheartened and leave the system. This is something that everyone can relate to. Imagine putting in the hours and hours of intensive effort and not seeing any results. It's extremely demotivating and can make giving up seem like the right solution. This can be the start of a cycle of blame and shame that can be expensive and hellish to escape. Now you know the 5 main psychological factors for addiction and why it is so important to find the right one at the beginning of treatment.